Hi everyone, this is Kelly. This is my husband John. Welcome back to Let's Talk About It with Kelly. This topic today is going to be female hair loss nobody talks about. Great topic. So the first question I have for you, John, what are the most common causes in women?
Common causes of hair loss, you mean?
Yes.
Okay. So the most common, in men and women, the most common cause of hair loss is what we call androgenic alopecia. And this is a sensitivity of hair follicles to specific hormones, androgen hormones, male hormones, specifically DHT. Now, in women, we get more variation with types of hair loss or causes of hair loss, and we get more complicating factors. So when we say that, a woman is genetically predispositioned to experience androgenic hair loss, that may be true, but we still need to investigate a lot of other areas that may be contributing to that. But certainly the most common factor is this underlying sensitivity to DHT.
Very interesting. How do hormones affect hair throughout the life stages?
So this gets really complicated.
Because everybody's different.
Yeah. So we talked about the genetic thing, the sensitivity. So the sensitivity is to hormones. So if you have this predisposition, then the fluctuation in these hormones can affect hair shedding and thinning.
Mm-hmm.
And we're going to distinguish those two in a few minutes. But any fluctuation of hormones can cause a telogen effluvium, a hair shedding, in men and women, but more often in women. So if we have a thyroid imbalance, we may get some hair shedding. We may get some telogen effluvium. If we have, any hormone imbalance can affect hair and cause a telogen effluvium. So that's why blood tests are really important, making sure all the hormones are balanced. The other thing that's really important is to understand is when you have this genetic sensitivity, the estrogen and androgen hormones really fluctuate throughout a woman's life.
Right.
Especially when you're having children, and through menopause. So if you have this genetic predisposition, then those fluctuations are going to affect your hair more. They're going to
brings it out.
Yeah, it's going to bring it out. It's going to exacerbate it.
Uh-huh. Okay, perfect. So why do so many women get dismissed by doctors? The last question kind of leads into this one, really.
In the sense, you're saying, they get dismissed because,
because they can say it's premenopausal. It's,
it's just genetic.
It's
there's nothing you
postpartum.
can do. They always say that, there's nothing you can do. It's just genetics.
It's just genetics. There's nothing we can do about it.
The other thing I believe, especially with, well, first of all, it's not considered a life-threatening or a health issue. They don't consider hair loss a health issue, which is absurd. It is a health issue, obviously a very important mental health issue.
But sometimes with hair loss, it's actually something else going on in your body.
Yeah, it can point to other conditions.
Conditions.
This is why we need to investigate it. But doctors they're not really aware of this. They don't get enough training. They're not trained by really specialists in the hair loss field, which is granted. That's fine. I mean, every area of medicine has its specialty. So, we trichologists are the hair loss specialists. And so doctors don't really have all that training. And that's just why we get a lot of referrals now from physicians. And I want to mention too, even dermatologists, most of them dismiss hair loss. First of all, their first appointment's only 10 minutes, if that. And
5 minutes.
All they're going to do is tell you that it's genetic, and they're going to tell you to use minoxidil. Unless we have, unless they've been sent by one of us, a trichologist, and they have a medical hair loss like a scarring alopecia, or autoimmune hair loss.
And you need a biopsy.
They need a biopsy, they need special treatment, then we'll send them and then they'll do it.
A special treatment that only dermatologists are allowed to do. That's when you would refer that.
Yeah.
For sure. But you, as a trichologist, really take the time, an hour, for your in-depth consultations, analysis.
That's just the first analysis. Then there's lots of stuff that goes on behind the scenes after that. We've got to look at blood tests. We may be looking at gut tests. We may be...
The biomes.
The microbiome. We may be, doing a biopsy, like you said. So there's lots of things that go on.
You take the time with your patients and really find out the root cause.
Yeah,
so
exactly.
It's important.
Yeah.
What's the difference between thinning and shedding? I really love this question because what is the difference between thinning and shedding? Because people use those terms very loosely.
Yeah, and they are important. So shedding is just, hair falling out. So some people call it hair fall,
right,
or hair shedding.
And that happens every day mostly.
Everyone sheds a certain amount of hair every day.
Right.
Whether you read these numbers, 50 to 100 hairs a day, I don't really see that many being normal, but maybe it's true. I know that, we see your hair all over the house. You've got this big, heavy, thick head of hair, and the hair's everywhere. And you're not losing any hair. This is just how much you shed.
Right.
So hair shedding is when hair is just coming out of the scalp in its normal growth cycle. So any hair shaft grows for a number of years. Then the follicle goes into a resting phase, the old hair falls out, and a new hair comes in and starts growing, and that new hair should grow for a number of years. So the shedding you see every day can be normal. In some cases, we'll see an increase in hair shedding. Now, there can be changes in shedding rates throughout the year, just like there is with horses and dogs and cats.
So like seasons?
You can get seasonal shedding.
Okay.
Males and females can have seasonal shedding. So that's a thing. We can also have, like we mentioned in the last thing, telogen effluvium is an increase in shedding due to some form of stress. So it's just shedding though. It's not thinning. It's not hair loss. It's just a shed.
Kind of like when your skin flakes.
Yeah,
right?
Say you got a sunburn, your skin flakes, then it grows back to normal. So you have a stressful event, you shed hair, the hair grows back in and goes back to normal once the stress is gone. So you can have these periods of shedding that maybe a little bit of telogen effluvium, but your hair returns to normal. So that's shedding. So thinning is when the hair shafts are actually getting smaller, or the follicles are producing shorter hairs and not producing these nice, long, thick hairs that they used to. So that's a thinning process where you may be getting fewer numbers of hairs, but the hairs that are growing are becoming smaller and thinner. And that's because the follicles are actually shrinking. And that can be, there's a number of causes, but the main one, of course, is the androgenic hair loss. Mm-hmm. It has this thinning process or miniaturization process we refer to as a main characteristic. So the difference is thinning is when the shafts are getting thinner and you're getting progressively thinner, less hair, whereas shedding is just, hair coming out of the follicle and then regrowing.
Okay, so not a major concern when it's shedding.
Most of the time, if you've got.
So what's a lot? Like if some people come in and they have a handful of hairs, but that could be shedding.
It's different for every person.
Okay.
If someone comes in for the handful of hair, we do see that a lot. Then there's probably something causing a telogen effluvium. Some people get really aggressive androgenic hair loss, and I see a lot of shedding all of a sudden. That can be a characteristic of androgenic hair loss. It can also be the beginning of alopecia areata, the patchy hair loss, where you haven't seen the patch yet, but you've got all this hair all of a sudden. Where'd this come from? Right. And then you rub your hands through your hair and nothing comes out, but you got this handful of hair. Well, there's probably a patch back here that you don't see that let out a lot of hair. Okay, and that's alopecia areata, how it starts. You start to see an increase in hair loss, but you don't see the patch.
Right.
But eventually that patch will form.
What about when you are doing your consultations or analysis? Don't you do some kind of hair pull test?
Yeah.
Is that what you look for when you do that?
When we're doing the hair pull test, we're checking the rate of the shedding. So we're trying to determine if it's normal rate or not. And that's often hard to do because, we haven't seen the person before. But we can be pretty sure that if we do a pull test, and the way I do it, and every trichologist probably does this differently, but I just use my hands, I rub them through the hair, I grab a bunch of hair, and I gently pull. And
It doesn't hurt.
no, it doesn't
No.
hurt because I might tug a little bit and the loose hairs are going to come out. So you're not going to pull out any hairs that are growing. You don't pull that hard.
Right.
These are hairs that are already in the resting phase.
Yeah.
So they're going to come out anyway. We're just seeing how many are in the resting phase. So if I go like this and I get 1 or 2 hairs, and I do that all over the scalp, every time I pull I get 1 hair or none or
Right.
2,
Yeah.
then I can probably say, that's pretty normal, especially if it's equal all over and the hairs look the same. And we'll often compare the thickness of the shafts that we get in our pull test. Of course, we'll look at the follicles as well. But if I get, 6 hairs and I put it down on the table and they're all different sizes, or I'll, and then I'll come back in the crown and I'll get 10 hairs. Oh boy, now I've got a lot of hair sitting here. And then I'll go to the back and I'll get no hair.
Ah, interesting.
I've got a real clue as to what type of hair loss this is.
Okay, well, you're
Because certain types of hair loss only affect certain areas of the scalp.
Right.
Okay.
Right.
If we have this shedding all over, then we got to consider other types of hair loss. It's a clue, but the pull test checks for shedding rates.
Okay, that's
And
why you do it.
We do that ongoing as well. Was when we follow up to see how the rates are changing.
And you follow up with every patient.
Well, we try to, yeah.
Yeah.
Of course.
Okay. Probably when people or women see this big pile of hair in their shower, the shedding, which is normal, they think they're losing their hair. So they stop shampooing because they think if they shampoo, they're going to lose more hair. Correct? This is a lot of times you hear this.
Yeah, that's a common thing that happens is
Right.
people
But that's
stop.
false, right?
Absolutely. The problem is so if you see shedding and it's normal shedding, but for some reason you think it's more or you suddenly start to worry about it, so you shampoo less, what's going to happen is every time you shampoo, you're going to see more hair because what's happening is every day there's hair going into this resting phase. So it's sitting in your scalp and it doesn't come out until a new hair pushes it out, or you shower and you pull it out mechanically. It can fall out on its own over time, but most of it comes out when you shower. So if you wait a week, every day you've got 50 hairs going into resting phase, and then at the end of the week, you're looking for 300 hairs
Right.
to come out in the shower.
Yeah.
If you haven't shampooed in a week. So that's absurd. Like that's an absurd amount of hair. You see that, you're going to panic.
Of course.
Right?
Yeah.
So if
And
you
that's what we see a lot.
Yeah. So if you shampoo your hair more often, you're going to see less hair. You might say, oh, okay, so this is only 20 hairs today, and it's only 20 hairs tomorrow. That can be perfectly normal.
Right.
Okay. But if you wait a week and you see 300, then you're gonna freak out.
That's right. For sure. For sure. Can postpartum hair loss be prevented? That's a great question.
Can postpartum hair loss be prevented? Probably not. I mean, you could probably try and do so. Postpartum hair loss is a complicated issue. Again, it is an indication that you are sensitive to androgens, that your hair is sensitive to androgens. So
Right.
you have a genetic predisposition.
Again, we're back to genetics. Yeah.
Genetic predisposition. So when you get pregnant, what happens is your estrogen levels really shoot up high. That helps protect your hair. So most women, not most women, women who are sensitive to androgens, their hair is sensitive to androgens, may see an improvement in hair growth and less shedding and thicker hair throughout their pregnancy.
So some
because of-
people lose hair and some people get more hair.
No.
Is that what you're saying?
During the pregnancy is when you get more hair.
I see. what
Okay,
you're
because
saying.
the estrogen levels are rising and they're counteracting the effects of androgens.
Right. And
Okay.
some women get hair on their face too as well.
I've never seen that
No?
in
I
pregnancy.
have. I have.
So I see that. You see that in PCOS.
Yeah,
is when
right.
you see that.
Okay.
But getting back to the pregnancy thing and the postpartum thing.
Uh-huh.
So when you have the baby, the estrogen levels, they just drop like crazy.
Mm-hmm.
So now your androgens can have their influence again, and you may get some increase in hair shedding. And the problem is when you have this shedding, when the hair tries to regrow, it may come in finer and thinner because the fact that you got that shedding means your hair is sensitive to androgens. So can you prevent this? So if you are already aware that you have a predisposition toward androgenic hair loss, then during your pregnancy, you're probably not going to do much in the way of treatments because most of them are contraindicated during pregnancy, although some might be okay, like laser or whatever. So you can, treat minimally through your pregnancy. Again, you don't really need to, but as soon as you have your child, if you're breastfeeding, you can't start treatment, but if you're not breastfeeding, then you can start treating right after you have your child and maybe prevent some of the shedding, but it's difficult. So I'm going to say for the most part, no, you can't really prevent it.
Okay.
But, if you are having this problem, then, treating as soon as you're done your pregnancy is advised.
Okay, so what treatment options actually work for women?
Okay, well, that's a big question. And again, we talked about this in the previous episode, there's a lot of misinformation out there about treatments.
Right.
There's a lot of companies out there producing vitamins and producing DHT blocking shampoos and, making all these claims.
Right.
The treatments that actually work for female, of course, it depends on the type of hair loss it is. So we have to look at that first. We have to know that, is it just genetics, first of all?
Right.
Probably not. There's probably some other things. So if there's some other things involved, we've got to find out what those other things are. Is there a hormone imbalance? Is there a nutritional issue? Those have to be fixed. So those, fixing those is treatment.
Right. And you would find that out through blood work?
You have to do blood work.
Right.
And you have to do a really in-depth case history of the problem and the person's health history. And we may be doing some other tests before we can even begin treatment. The treatments that are going to work for pattern hair loss or androgenic hair loss are still quite limited. We don't have a lot in 2026 that actually works, okay?
For women?
For women or men. So for women, we use topical minoxidil. We use oral minoxidil. We're using more topical finasteride in women. We like to avoid oral finasteride in women because it can cause birth defects.
So you would not prescribe anything like that if you were a woman in childbearing years, basically?
I generally will not prescribe. I know there's a lot of trichologists and dermatologists who do, but I would not recommend oral finasteride to a woman in childbearing years. I'm okay with topical because topical minoxidil is approved for women, but you have to stop during pregnancy. So if you can use topical minoxidil, then you can use topical finasteride. You're going to stop it before your pregnancy.
How long do you think? 6 months? A couple months?
A couple of months is you don't need
That's
to
something you
stop
talk
6
about,
months.
yeah.
Well, no, there's specific time. Finasteride is 1 month. Minoxidil, I think it's 1 month as well, is what the recommendation is. Their half-lives are a lot shorter than that, so that's going to be out of your system, but that's going to make it really safe. So those are, the two main drugs that are often used. Now, for women, we can also use spironolactone. Spironolactone is an anti-androgen, or it's actually a diuretic, but it has anti-androgen effects. We can use certain birth control pills, have some anti-androgen effects. Some women who take certain types of birth control may see improvements in hair growth. So those are options, medications. There are some other...
Like PRP and exosomes.
Well, I'm talking about medications right now.
Just
so
medications?
there are some other medications that are used sometimes, but they're very rare and they don't have a lot of great evidence. Now, the other treatments, like you mentioned, so PRP and now exosomes. Now,
you got to be careful. That's going to be another topic too as well.
Well, you're just asking what the treatments are, so I'm mentioning it.
Right.
So PRP and exosomes, but exosomes, we have to be careful. We're not using, these plant-based
or animal-based
exosomes. There's no good research on those. Exosomes that come from your own PRP are certainly going to be more compatible with your own DNA, and they can therefore be injected.
Right.
But it needs to happen with PRP in order to be effective. So PRP, and low-level laser therapy, I'm a great believer in. I see a lot of good things happen with low-level laser therapy, and there's no side effects from it. It's very clean and easy to use.
Yep.
Those are the main ones that have evidence.
Evidence-based.
Most of the other stuff, that you see out there doesn't have real evidence. And even if they say they're clinically proven, if you read their clinical
Trials.
research and trials, most of them, they're not even published.
Wow.
So if you go on PubMed, that's where you'll see a lot of real published
PubMed
articles. So remember that PubMed.org. It's just a collection of studies from all around the world. There's hundreds, there's millions of them.
and anybody can go on there.
Anybody can go on. They're not all free, but a lot of them are. So you can read a lot. But
That's good to know.
yeah. But most of this stuff, like rosemary oil, has no good studies on it. Most
really
of them are
popular.
really small. Oh, I know. The point I wanted to make was, when you see something that says clinically proven, that could just mean that they gave it to 20 people and those 20 people said, oh yeah, it helped my hair. That's what they call clinically proven. That's not clinically proven. That's not a real study.
It's not a
large enough sample of people. And, you're not taking into account any placebo possible effect. And on 20, if you have 20 people and 18 of them say, oh, that helped me, they could all be placebo because it's such a small sample.
Right.
So these people that, these so much stuff out there that claim to be clinically proven, it's not clinically
They're not.
proven.
You need to have the study.
They're
to
not really strong,
Right.
verifiable studies.
And the treatments that you offer, the low level light therapy, the topicals that you have, and the PRP and exosomes, those are all proven.
Everything we do has good research behind it.
Right. Okay.
Published research.
Published research.
Published
and they
peer-reviewed research.
Okay. So the best results that you get for women would be all three. You would probably recommend.
Well, the more treatment you do,
You've seen the best results that way, though, I think, right?
Well, the more you do, the better results
Right.
you get. Absolutely.
Okay, perfect. Thanks, John. Just one more question. How do you rebuild confidence during treatment?
Hair loss treatment
could be shattering confidence.
Oh, it is. I mean, people who come in with hair loss are, their confidence is usually greatly affected. So the idea behind treatment, obviously, is to improve the hair growth. The most important thing about it is to show the patient, the client, that the treatment is working. And that takes detailed follow-up. So a person comes in, we'll do an analysis. A woman comes in, we'll do an analysis. We'll determine the type of hair loss, and we'll come up with a treatment plan.
Right.
So, of course, there'll be, that might be that's a process that could take a month because we might have to get blood test results. We might have to get biopsies, whatever.
Yeah.
So, but once we have our treatment plan, first of all, we're going to explain the treatment plan so that helps people feel better right off knowing that they have a treatment
Just so you're
plan.
listening to them, I think,
Yeah,
right?
just that they're listening
Yeah.
and that you're, and there is a treatment plan. But then we monitor this treatment plan in a way that really shows the person what is happening. So that involves, we do this initial analysis, but we'll do analysis every time they come in to monitor the progress. So we use very detailed before and after pictures of our treatment plan.
Yep.
We keep on doing the microscopic analysis and pull tests to make sure that shedding is being reduced. Mm-hmm. And then we show them these things. We show them this documented data. And this,
You show the progress and they can see results.
Yeah, they can
and
see it.
That's a confident booster big time.
yeah, it helps them a lot. Yeah,
Right.
because they know that their treatment plan is helping them.
Awesome. That's great, John. Well, thank you so much for answering those questions on this topic. Next week, we have a great topic, male pattern baldness. When should you act? Great topic. Stay tuned. Thanks a lot, John.
Okay.
See you next time. Thanks.
Bye.
Bye.